Hi everyone, I am Dr. Heather Christianson, and I am a third-year family practice resident here at Samaritan. My quality improvement project this year focused on maternity care in my continuity clinic site here in Corvallis. Before starting, I'd like to briefly define a continuity delivery. It means that a woman would have her prenatal care and subsequent delivery by the same provider, or in this case, a resident physician. A little background on this topic. Despite being equipped to provide full-spectrum care including prenatal and obstetrical visits, the number of family medicine physicians offering these services has steadily declined in the past 5 years. The AAFP reports that only 28% of family practices include obstetrics, and this could be why many patients do not pursue obstetrical care from their PCP. Another possibility is that they are unaware that their PCP is qualified or willing to provide such care. Whatever the reason, the decline in patient volume in our resident clinic mirrors that of what is happening worldwide, fewer babies being delivered by family practice physicians. In our residency program in particular, we are having difficulty maintaining our delivery numbers as well as routine prenatal visits. This was an issue outlined in our strategic priority meeting that occurred during April of 2020 and is the reason for this intervention. Since that time, the ACGME has proposed that in order to graduate, residents must have no fewer than 20 deliveries, and we are currently not on track to meet this metric. With a national shortage of doctors predicted in the coming years and more family practice residencies being formed than obstetrics-specific residencies, family practice doctors may be asked to cover this gap in prenatal care. I created a poster highlighting the role of residents in providing maternity care. This was hung near the scales in each pod in the Corvallis Resident Clinic in February of 2021. The hypothesis for this quality improvement project was that by indirectly informing patients that we offered prenatal care, more established patients would deliver with the resident clinic. For ease of calculations, comparisons were only made against the graduating class of 2021 versus 2022. You can see in Table 1 that the number of impaneled patients to the clinic that were pregnant in 2020 was similar to 2021. However, so were the percent of women who sought OB-specific care. This would indicate that the poster likely had no effect from year to year. However, we do see that the maximum number of deliveries by a senior resident increased from 7 in the 2021 class to 9 in the 2022 class. While individual effort or unforeseen circumstances could have factored into this change, and that these posters may not have had the desired effect, I think the main realization here was that the number of patients available to Corvallis family medicine residents far exceeds the goal number of deliveries set by the ACGME. A QI project for the next class could include a more substantial look into how to capture these opportunities for residents so that they can supply the next generation of family practice obstetrical providers. Thank you.